Hello, I'm Charles Clapsaddle, Station Manager for Manatee Educational Television. Today we have a very special program, a special edition of the Centerstone Report. Recently, Centerstone, one of the nation's largest nonprofit providers of behavioral health care, and Manatee Glens, the specialty behavioral health hospital and outpatient practice, announced an affiliation, effective July 1st, 2015. This is exciting news and opens many possibilities for the over 15,000 patients and 450 staff of the former Manatee Glens, now Centerstone of Florida. It also opens up opportunities for Centerstone of America nationwide. With us today is David Guth, CEO of Centerstone of America, and one of our very special guests, our favorite CEO, Mary Ruiz, the president and CEO of Centerstone of Florida. Welcome to both of you. David, it's so nice to see you again.
Charles, good to be back.
Thank you for taking the time to do this. And Mary, it's always a pleasure to see you.
Yes, but you just got me in trouble with my boss because you need to say he's the favorite CEO.
No, she's my favorite too, so you're doing good.
Well, I must tell you, I think it was back in September of 2014 that you did a special news conference over at your facility, and then hosted a program here on METV about the affiliation. It was very exciting news at that time, but now you've moved into the final completion of this, and you are now officially known as Centerstone of Florida. And David, I want to start with you. This is a wonderful opportunity for both Manatee, the former Manatee Glens, and Centerstone. Tell us a little bit about why this is such an important affiliation.
Right. Well, one thing, Charles, and again, thank you for having us back. One thing from the Centerstone perspective, getting Mary and her team on the Centerstone team has been enormously beneficial. I think you know this, but I don't know if everybody in this area knows what a treasure they have in Mary Ruiz and how well she is respected nationally. I think I talked about this last time, but the first thing that attracted us to this organization was Mary and the national reputation that she had. And frankly, her team is excellent top to bottom. So we've been very pleased to have that. Mary, in addition to leading Centerstone of Florida, is also Centerstone's new Chief Strategy Officer. And so bringing the talent that she's used to advance Manatee Glens now to help advance the overall Centerstone system has been very, very important. In addition, these affiliations are all about bringing together the strengths and the various assets that our organizations have and doing something together that we couldn't do alone.
Well, Centerstone nationally has under your leadership and under your vision, it really enjoys a wonderful reputation for bringing services throughout the country. And to be here in Florida now is certainly a great thing for our community. And thank you very much for bringing this service here to Manatee County. And it's very exciting news. Don't you think so, Mary?
Oh.
She hasn't stopped smiling since the...
Absolutely, absolutely. It's exciting because our community really has an ability to pull together to take care of needs. And I've always been very appreciative of that. One of the reasons why our organization has been so great is our community is always behind it. What we haven't had is the kind of infrastructure that would allow us to really reach for the kinds of technological advances, the new science-based ways of approaching things. And so this really puts us within reach of state-of-the-art care nationally. And that's why I'm really excited.
Well, I think that's an important point. I mean, Manatee Glens has always, met and or exceeded the needs of this community. Your staff there have been exceptional. They have a true depth of caring for their patients that are there.
Thank you.
But aside from that, there's always been that opportunity to grow and to blossom and to use a wider strategic plan to fulfill some of the things that you want to accomplish. And I think with Centerstone now, that's easily achievable.
I agree, and I think that it strengthens us in other ways because our cultures are so similar. We come from community mental health. We share the focus on the clients. We passionately care about these families. We want the best for them. And now the family has grown from 450 staff to how many?
Yeah, 3,100.
Yeah. So there's a depth of specialties and expertise we could never replicate on our own, as David says. It's something we couldn't do on our own.
Well, I think the strengths that Manatee Glens has had and continues to have, and the strengths that Centerstone has continued to prove over and over again throughout the duration of the company, have come together. So you have a joined, combined strength now. You're bringing all your background in community health matters, the background that Centerstone brings. There's really a synergy there.
Absolutely, absolutely. Now, if I can say, one of the strengths that we bring together is that this is a marriage. We've brought together a total of 15 organizations. So all of us had our roots in working in smaller organizations, working very closely with our communities. And as a result, we have a wonderful, wonderful group of board members throughout the states that Centerstone serve who are volunteers. They are passionate about their communities. They're passionate about those that have mental illness, addiction, trauma. And as a result of that, I think one of the magic elements of Centerstone is that we have these very similarly minded, just amazing people in these different states. The leadership from all the Centerstone organizations getting together next month, the board leadership, to talk about how the work that we're doing together can be accelerated. So it starts with these really terrific people.
Well, I'd like to kind of follow up with that, if I may, but the organization itself, because you're going to be celebrating 60 years of not-for-profit service this year. First of all, that's a remarkable achievement for any organization,
Right.
but 60 years plus is really a wonderful achievement, and congratulations on that. Where are you located? Where is the scope of your services, and how extensive are the services that Centerstone provides?
That's a great question. So our primary footprint is in now Florida, Illinois, Indiana, and Tennessee. So where we have facilities and staff that are dedicated to those facilities and those programs, those 4 states. But in addition to that, Charles, we have a network of therapists that work with us around specialty issues. We have a program for men and women who have served in the armed forces and their family members. We provide free confidential services coast to coast, border to border, all across this country, and we have those therapists in every single state.
I just referred my niece, who just married a serviceman, to Centerstone Military Services.
I think that's a wonderful thing, and I think as more and more veterans are returning, and then there's a need for those services, this is really unique and a very, it's a great initiative on your part, David, to be able to provide those services.
Well, it is a tremendous need, and it's one of those things. I know we talked about this last time, Charles. It's one of those sad truths that right now it is a crisis, and all the predictions are this crisis will grow.
Correct.
And the other side of that crisis is that this is something that absolutely can be treated and helped.
Absolutely.
And it's a matter of just aligning folks that have the will and the energy and the compassion to make it happen. And so we've been very fortunate. Those military services that we provide are available at no cost, confidential, as a result of partnership of organizations like the Wounded Warrior Project,
right.
Private, some of those anonymous donors that have stepped forward. So recently we just had a campaign where all of our boards stepped in to help create some additional opportunities to serve these men and women who have served us.
And the members of the public are invited to participate
Absolutely.
in that effort, because we want to be able to serve everyone who calls.
That's right.
And congratulations to doing that. Aside from the many other services that you offer in behavioral health, to be able to step up, and to be able to treat the returning veterans is a wonderful thing, and you're to be congratulated for that, to have that kind of initiative. And again, it's just a wonderful idea. But talking about the public, inviting the public, you've got a ribbon cutting coming up.
Yes, we do.
And that's just right around the corner. Tell us about that.
Yeah, it's September 15th at Centerstone Hospital and Addiction Center, which is at 2020 26th Avenue East. 4:30, so you can leave work a little early, or pick the kids up from school and come over. It's very informal. The Chamber will be doing a ribbon cutting on
Wonderful.
Centerstone. Our new signs will be up. And we want to invite people to come and have a look and get familiar with the services that we're offering, and kind of reintroduce ourselves to the community.
And I think that's really important too. I mean, as David has mentioned, it's a new name, but it's the same great services and resources, staff, and innovation that Manatee Glens has always been known for.
Absolutely, and wait till next year. We'll have more to talk about.
Well, I'll welcome you back next year. We'll do this on an annual basis, if not more frequent. But do you see any changes immediately, Mary? Do you see anything that's going to change in the operation or the services that are provided under your new name?
What changes is really behind the scenes. The things that could affect the future of the agency, things that aren't very exciting to talk about, accounts receivable and cash flow and the health plan, and all of those services now are provided by a national infrastructure, and that frees the board and the staff to focus on the services. I joke with David, if I never have to do another health plan bid again as a CEO, I couldn't be happier.
We have their great resources to help you
Exactly.
with
So what I see changing is that more of the management team that's here on the ground can focus on the community and the services, and offering new services and expanded services and specialty services. So we're very interested in leveraging the expertise in veterans. There are very exciting developments in our field with using iPhone apps to support your recovery, either in addictions or from mental illness. Genetic testing that helps the doctor match the drug that's the best for you. Very exciting things, and that's what we're really looking forward to, is being able to continue to build the excellence that we have with this new research, this new science, which frankly is not very available anywhere.
Well, and I think too, having the capability to use technology as part of the tools that you have for outreach and intervention is a wonderful thing, because that in itself allows you more time to concentrate on that one patient. So, and that's a great thing, and I think technology is a great application for some of the services that you can provide. But long term, will there be perhaps additional services that you can provide? I mean, I'm just in a big picture. The immediate things, outreach, mental addiction problems, you're going to continue the same wonderful level of service that you've always been known for. But there are, visions, I'm sure, of adding, perhaps another capability. Do you see that in the works?
What we want to do is leverage Centerstone's incredible grant writing shop. How many millions did they pull in this year?
This past year, just under 20 million in new program
grants
awards.
And things. That's a wonderful accomplishment.
And
it's significant.
We just got a notification of, it was 2 grants for integration of primary care with behavioral health. And so that's something that we're very interested in, because people with severe mental illness die 25 years before their time. Not
Because
from
they
the mental
don't
illness,
outreach for any kind of medical.
but because of the medical issues.
Exactly.
I think the medical community feels at a loss how best to serve these folks, because they already present with a very serious chronic illness, which many primary carers are not well trained in. That's not what they do. They're generalists. And so we're able to offer primary care within the specialty of behavioral health, which I think is going to improve the healthcare outcomes, because it's very frustrating when someone is in mental health recovery
And they have diabetes.
but then they succumb to their diabetes. The old joke, the treatment was successful, but the patient died. That's not very satisfying to us. So the big thing that we'd like to move toward is closer to offering an integrated service in healthcare, and then the reverse. We have expertise in care management that general health care doesn't have. We're used to knocking on the door and saying, did you take your medicine? Do you need transportation to the doctor?
Have you taken your blood pressure?
Right.
And have you done this? Are you watching your diet? Those are the things that you do as part of the treatment and outreach that you've continued with all of your patients.
But we could do it for the diabetic without schizophrenia. Yeah. Because it's the same techniques and the same technologies.
There's a great opportunity there for that sharing of knowledge.
Right. So what I say is, after the diagnosis and the treatment plan, pretty much everything else is behavior. And we're the behavioral experts. So we want to transform all of healthcare. We're not starting small. We want to transform all of healthcare so that people can experience recovery from any chronic disease, not just a mental illness or an addiction.
And I think probably that's a way of the future, because more and more health care providers are going to have to work together, team together, whether it's a nonprofit or a for-profit. They're going to have to find those middle grounds to work together for better outcomes. But I want to go to kind of segue off of that, because David's not only a successful and visionary CEO, he's also a published author. And we're talking about nonprofits. You've wrote a book on the nonprofit affiliations, and it's called, to make sure I get this right, Strategic Unions, a Marriage Guide to Healthy Not-for-Profit Mergers. It's quite a title. But tell us a little bit about that, because that's a very interesting concept.
Well, I've worked not only in bringing organizations like ours together within the Centerstone family, but I've been asked to work with organizations around the country that are coming together outside of the Centerstone family. And so I've done this kind of work for many years. And it's very gratifying, Charles, when you bring together like-minded organizations that are all built around mission of serving their communities, and you help them develop a partnership that creates a stronger service. Very rewarding. But it occurred to me a number of years ago that there wasn't a very good paradigm or understanding of how this needs to work, and that really the unions like we're involved in are more like a marriage than they are an acquisition or in a for-profit world. So after coming back from a conference and saying to my wife, I can't cover enough of this in a 1 hour or even a 5-hour workshop, I wish I had a book. She said, you're not permitted to say that anymore. Either write the book or just be quiet. So I wrote the book.
And I think it's an excellent thing too, because as you just mentioned, like-minded organizations need to have that kind of connection. How can we best do it? What are the benefits? What are the pitfalls? All of those things. And I think that there's a lot of nonprofits that would welcome, that knowledge that, is out there, how best to come together. But I want to move on, because, I want to touch base on as many great things that you're doing here. But first of all, what are some of the major behavioral health issues that concern you, both on a national level and here in our community, throughout the state? What are those behavioral health issues that you're seeing that need to be addressed?
Right. It's not hard to come up with a short list, because in Florida, you are 5 times more likely to be in jail than in a hospital if you're mentally ill. So we have criminalized people who have a serious mental illness who just can't get access to care. Florida is 50th out of the states in mental health funding. And so our jails have become our psychiatric hospitals. So that's a concern to me, because I feel it's a civil rights issue, not only a treatment issue. I think the second thing that maybe is more top of mind with our community is the heroin, pain pill, fentanyl overdoses.
The addiction issues,
Right.
where it's kind of really mushroomed in this past year or so.
We have removed more children from their homes for their safety in the last month than in memory. because parents cannot take care of children if they're using these kinds of serious substances. We're also losing young people. I think there were 68 deaths in the last 18
Fatalities
months.
have spiked more in this year than they have in the last 3 previous years.
So there are treatments. I'm very grateful to the funding that our county commission gives us for detox, and they're struggling to keep that going with the exhaustion of the healthcare fund. But in truth, we need major increases in resources because we just can't keep ahead of this tsunami of tragedy that's striking our community. And what saddens me is it's hitting the 20-somethings. That's our future.
And it's a terrible tragedy. I think, as you mentioned, the heroin now is laced with this fentanyl, which makes it even more of an addictive thing.
And more dangerous.
10 times more dangerous. And we just did a program on that, and it's the receptors in the brain just crave it more and more now. But I'd like to just briefly do a little aside, because you talked about people that are in jail that need mental health issues. They're not getting that mental health issues in jail. They're not getting treatment in jail. So
well,
if they're serving time,
they are getting treatment. Our sheriff has healthcare services. Our psychiatrist is there 20 hours a week. We have 2 social workers, 2 licensed clinicians there. But jail is stressful. Jail is not designed for treatment. And so it's really doing the best you can with a bad situation. You will not find a better advocate for mental health diversion and mental health treatment than Sheriff Brad Stubbe.
he's done a remarkable job.
He really has been very forward-thinking. But I think that we have to step up as a community and offer more services, so that he doesn't end up having to treat them in jail.
With limited resources that you have and limited resource and limited funding to do things, you're not going to be able to treat people, and then eventually they're going to be walking out because you can't stay in jail forever, and they're going to go back onto the street with the same kind of mental health issues that they had when they first came.
You're absolutely right. And what's so frustrating to us is we know treatment works. We know we could help them. We know it doesn't have to be that way. They could be volunteering, they could be working, they could be raising their own children. And so it's, we feel a great sense of urgency.
And let me change gears here, if I may. Priorities. What do you see, David, as some of those priorities now for behavioral health issues now and in the future? What are those key things? Not only for here in Florida, but throughout the country. What do you see where those priorities are?
Well, a couple of things come to mind. First of all, in the developed world, depression is the #1 cause of disability, despite the fact, Charles, that it is incredibly treatable. Over 80% of the people with depression of all types can be in complete remission with today's treatment technologies, and yet people get treatment that's outdated, that's not effective for their particular presentation. So this is something that we're very passionate about. Depression and suicide is one of the leading causes of death among our young people, one of the leading causes of death among our elder population. It is obviously a huge concern and an epidemic among those who have served. So for us, a big piece of this is getting the message out that there is help, and then working on bringing the best of the science of care to our communities.
And I also think, too, as you mentioned, we want to talk about the, Walk for Life in just a moment, but also, to bring this to a national attention as well. And I can see from the success and, from, as a major leader in the industry, that you want to get the ear of, the legislators, both state and federal people, to bring to the attention the importance of funding and the importance of great mental health care.
Absolutely. And these are issues that affect every family. And in many cases, folks deal with these challenges in isolation. And they don't realize that their neighbors, the people they attend church with, the folks they bump their grocery cart against in the grocery store, every one of these families has somebody in their family that has an addiction disorder or a mental health issue, a mental illness, has been the victim of trauma. These are conditions that we all share. In our families and in our circle of friends. And so it's a matter of getting to the place where we can talk about it. The number one obstacle to all this right now is still the stigma that's associated with this.
And I think that's a big part of it. And I think, as you mentioned, there, within a family, within a community, within a neighborhood, there are people that have some kind of condition that's easily treatable with professionals, either at Centerstone of Florida or wherever in the country that Centerstone provides services.
That's right.
And I think that's a key thing. There's help out there for young people, for families. There's help out there, and there's no better way to go than Centerstone of Florida.
Right. Call us. Go on the website, call us. You can walk in at our walk-in center at the 300 block of 6th Avenue West, or our Access Center at 2020 26th Avenue East. No charge.
Wow.
It's
a remarkable
free.
place.
Can't get a better
encourage
price.
people, to find out if you have a family member or a friend or someone that that can benefit from the fine services that Centerstone offers. Get in touch with Mary and her wonderful staff. But I want to briefly talk about the Centerstone Walk for Life.
Yes.
We've been very fortunate over the years to be part of the Walk for Life. It's a wonderful occasion. There's literally thousands of people show up, David. It's a wonderful occasion. It's very moving and it's very emotional. And Mary, you're to be congratulated for having this event each and every year. What can we look forward to this year?
Well, we walk for depression awareness and suicide prevention. We organize the event. It's Saturday, September 26th at Sutton Park.
Right around the
north
corner.
of the river, right around the corner. We organize it with the key clubs in all the high schools.
True.
So this is high energy, 800 teenagers. And then moms and dads show up and businesses. And one of the surprises over the 13 years that we've done this walk is we have been a source of help and healing for either survivors, people
Very
who have
much
attempted
so.
suicide, or families who've lost loved ones to suicide. It's not something they feel they can talk about. They do family teams in honor of their loved one. They feel accepted and understood. It's very uplifting. We have a butterfly release. We have a white dove release, and lots of high energy, a DJ. So even though it's a serious issue, we have a really good time. You can register at 8. You'll be out by 10:30. You still have time to do something else on Saturday.
It's a wonderful occasion, and you're right. It's very joyous. But as David mentioned, the high rate of suicide among young people is skyrocketed. And what you've done over the years is bring people together and to show them that suicide is not the way out. You've had speaker after speaker, family members, survivors, talk, what it's meant to them to lose a loved one. And it's really a moving experience. Even though it's a wonderful thing, people are dancing at like 7 in the morning, which is a little beyond me, but it's a wonderful occasion, and you really are to be congratulated now. The Centerstone Walk for Life, give us the dates and times again.
September 26th, Saturday at Sutton Park in Palmetto.
Right. Well, as we wind down here, I just want to follow up with one question. And David, I want to start with you. What do you most look forward to in this partnership, in this new, and we'll use the word marriage, okay? Because
Right,
I'll borrow it from the name of your book. From this marriage, what are those things that you're most looking forward to in this new affiliation?
Well, Charles, you touched on this earlier. We do share service expertise, and Mary's team brings some unique services that the rest of the Centerstone team doesn't have, and as well as there's opportunities to take some specialty services in our other states and to migrate those services here. So that, to me, that's the biggest benefit that comes out of this, is bringing really smart, committed people together and just figuring out how to bring more depth of services to the communities we serve.
And Mary, this is a wonderful organization, national implications here. What are those things that you're most looking forward to in this affiliation?
I think that our 60-year shared legacy is something that has been carried very carefully to the present. and it's our responsibility to carry it into the future. We've accomplished so much in the last 60 years. I would like us to look forward to something that dwarfs those incredible accomplishments, and I invite the community to get to know us as Centerstone and to help us achieve that.
Thank you, and thank you, David, for joining us. You know, Manatee County is very lucky to have a resource like Centerstone of Florida. And Centerstone of Florida is very lucky to have a resource like Centerstone of America. And together, I think you're going to be able to bring a great many resources, services, and initiatives to the citizens here in Manatee County. And I can't thank you enough for taking the time to do this.
Thank you.
David,
Charles,
thank you for
so
joining
much.
us. Mary, it's always
Thank
a
you.
pleasure to see you. And that about wraps it up for the special edition of the Centerstone Report. I want to thank David Guth, CEO of Centerstone of America, and Mary Ruiz, President and CEO of Centerstone of Florida. Thank you for joining us and for tuning in to the Centerstone Report here on METV, where you can learn something new every day.
Absolutely.
We're going to talk, and
Yeah,
we're
we're
just
going
gonna
to talk a
pretend
little
like we're
bit.